Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. So many of us are underinsured or we're without insurance, and it's frightening with the high cost of medical care. We'll talk about that on today's program. Talk about an option that literally is saving consumers thousands of dollars each year. With us on the program is Kelly Blackwell, National Sales Director for Ameriplan. Kelly, welcome to This Week in America. Great to have you with us on the program.
Thank you so much. Thank you for having me. It's a pleasure to be here.
Oh, it's our pleasure to have you here to talk about this. We are all looking for ways to save money. The nice thing with your program is that it really can save money. There's so many benefits, and we'll talk about those individually as we go through. One of the focal points that you talk about is dental health. Why did you focus on dental health? Because most people think, well, everybody's got a dentist, that type of thing, and dental care. I mean, it's not that important. I know you've got a story you'd like to share. Tell us about dental care, why it's so important, and why the focus on it.
Right. Well, 70% of Americans today do not have any dental program, no dental access. And so it's a big area of concern because dental health is actually far more serious than most people give credit for. A story I do like to share is last year, ABC News reported in September that a 24-year-old father reported to the dentist with dental pain, severe pain, and the dentist, he had a tooth infection on his wisdom tooth. The dentist gave him a prescription for pain medication and antibiotics. The gentleman could not afford both, so he opted for the pain medication because he was in so much pain. And unfortunately, that allowed the tooth infection to spread. His brain swelled and he passed away. So overlooking the things that you have going on in your mouth can be very serious, to your health.
And I've seen reports recently that have related tooth problems with heart disease. So you keep reading these stories, and it's like maybe you really do need to take care of these. I want to talk about Ameriplan, then we'll come back and we'll talk about some of the specifics in the program. What all do you offer in your program?
Well, we have a dental program that is $19.95 a month for an entire household. That's everyone living under one roof, related or not, and it includes savings off of dental care, vision care, prescriptions, and chiropractic care. We also have a medical program for $49.95 a month for the entire household, and it includes everything the vision program includes, plus savings on doctor's visits, specialist care, savings off ancillary services like lab work, MRIs, CAT scans, diabetic supplies, hearing aids, you name it, anything health related, acupuncture, LASIK eye surgery, all of those things are included in that program. So it's a very comprehensive package.
Kelly Blackwell is our guest on This Week in America. The website to get all the information on what she's talking about here is cutmymedicalcost.com. Really simple to remember, cutmymedicalcost.com. A simple telephone number to remember, if you want to do it that way, is 866-79-TEETH. 866-79-TEETH. Of course, information at our website, thisweekinamerica.us. Let's focus on the dental plan that you offer. Some people will say, yeah, that sounds good, but how long do you have to wait before I got a problem now. How long do you have to wait before you can actually see a dentist?
Yes, a traditional insurance plan does have a waiting period of 6 months for certain pieces to be used and 12 months for other. You actually have to pay premiums 12 months to start using the benefits. With our program, that's not the case. There is absolutely no waiting period, and our prospects can sign up today and call a dentist today and save that money right on the spot.
What type of savings on average are we talking about?
They'll range anywhere from 20% to as high as 80%. It depends on the item that is being done, the procedure. We do offer savings off of all procedures done by a dentist, a dental specialist, whether it's oral surgery or just regular dentistry, endodontics, and so forth. And our clients get a book with a fee schedule in it, so they know exactly what they're going to pay and what the discount is before they have a procedure done.
A lot of people worry about calendar year, and I'd like to go to the dentist. I'd like to go somewhere, but I can't see a doctor now because I've overspent for the year. Does that apply in your case?
It does not. We do not have any spending limits on the calendar year. So if you need, $4,000 worth of work done, which sounds like a lot, but you get there pretty quickly with dental care, you can actually have all of that done in a single year, which is very unusual.
How about if someone is listening to the program, they're not a U.S. citizen, and sometimes it's difficult to get plans like this? Would they qualify?
Yes, everybody living in America is eligible for this. No U.S. citizenship is required because this isn't a government program.
Does it cover anything other than dental?
We've got vision and chiropractic and prescription care in there.
And we mentioned the price before. Go ahead and mention that again, and I'm going to ask you about that because some people may go like, yeah, that's a special introductory. They've got me into the program. Now I'm going to have to pay more. First of all, what is the price, and then how long is that price good for?
Okay. The price is $19.95 for an entire household. That's anyone living under the same roof, whether they're related or not. And it's $14.95 a month for an individual. There is a one-time registration fee of $20. That covers the cost of us printing out their provider cards, membership cards and provider booklet, and shipping that out to them. There is no contract. You're not locked in. It's a month-to-month service only, cancelable at any time. And the rates are locked in for 2 years. This is not an introductory rate. It is our going rate, and it's been this rate for many, many years.
How many years have you been doing this? Because I know, again, with dental, it's something like, boy, it's so expensive, and my employer may not offer that or may not offer much. How many years have you been actually doing this, providing dental plans?
Well, AmeriPlan's been around for 20 years now as of this coming July, and I've been with the company for coming up on 5 years in August. So it's a very viable, solid company with a lot of very happy customers, clearly.
And you deal with them, as I mentioned, Kelly is National Sales Director, and you talk about not only dental, but you have other programs, medical programs as well, that will save people thousands.
Right, absolutely. I mean, the list is almost endless. From hearing aids and diabetic supplies, we have LASIK eye surgery, we have pulse site LASIK, acupuncture, massage therapy, holistic medicine. Any of those things can be a part of our program and save people money, tremendous amounts of money.
As you deal with people all across the country who are really trying to save on medical costs, and it's frightening now, the magnitude that the way the prices are going up, and you're dealing with them on an ongoing basis, are more and more people looking to options like this?
They are. Today, with the economy being what it is, things have really changed, and a lot of people do not carry any insurance whatsoever anymore. Many employers have dropped their plans just to allow themselves to keep their doors open. And with the escalating price tag on healthcare for employers, that's resulting in many people without, and also a lot of downsizing that's taking place over the last few years. So people, in order to afford traditional insurance plans, are generally having to bump up their deductibles. They're going to deductibles of $2,000, $5,000, $10,000 before the insurance pays a dime. And that's not what it used to be. When I had insurance many, many years ago, when I first started working, our deductibles were $250 or $500 per month.
Yes.
When you're bumping them up to $2,000, $5,000, or $10,000 just in order to make your monthly premiums affordable, you're basically paying every month to not use a service unless you have a catastrophic accident or illness.
Well, when you look at the rates at that, you think at the time it's a prudent decision until you actually have to use that, and suddenly you've got literally thousands of dollars going out of your pocket to meet your deductible.
Right. Lots of money going out the door to meet the deductible, and then let's face it, after you meet the deductible, you're still going to be responsible for 20% to as much as 50% of the remaining bill based on most traditional plans.
Well, here's a viable alternative. I mentioned in the beginning that it's an option many, many people all across the country are looking into and taking advantage of. Kelly Blackwell has been our guest on the program. She's National Sales Director for AmeriPlan. Her website, cutmymedicalcost.com, cutmymedicalcost.com, and the phone number, simple to remember as well, 866-79-TEETH, 866-79-TEETH. And you get all that information, of course, at our website, thisweekinamerica.us. Kelly, great information. Thank you for sharing it on today's program.
Thank you so much for giving me an opportunity. Appreciate it.
You're welcome. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.